You know that feeling when your shoes suddenly feel too tight or your ankles look puffy. That's what we're dealing with. So, what's going on here? Well, swelling in your lower extremities, also known as edema, happens when fluid builds up in the tissues. It can be caused by a variety of factors, like standing or sitting for long periods, pregnancy, certain medications, or even underlying health conditions like heart or kidney problems. While it's always a good idea to check with your doctor if swelling persists, there are actually some simple and pretty effective remedies you can try right at home. In this video, we will reveal to you 10 amazing home remedies for your swollen ankles and feet. These remedies are easy to try, affordable, and have science backing them up. Now, without any further ado, let's get to it. Number 1. Elevating your legs. We know that if you stand for too long, gravity causes your blood to pool at your lower extremities. However, by reversing the position of your legs, you can reverse the effect of gravity on them. All you need to do is elevate your legs above the heart level. This way, you will use gravity to help drain excess fluid from the legs and feet back to the heart. In addition to that, elevating the legs reduces pressure on the veins in the legs. This will promote better blood flow and reduce fluid accumulation. Simply lie down and prop your legs up on pillows, ensuring they are above heart level for 20 to 30 minutes. Do this 3 to 4 times a day, and you will notice that the swelling of your ankles and feet diminishes. In fact, a study published in the American Journal of Medicine found that elevating the legs for 30 minutes 3 times a day reduced edema in patients by 20 to 30%. Number 2. Magnesium supplements. Magnesium plays a crucial role in regulating fluid balance and can help reduce water retention and swelling. Magnesium achieves this by improving the function of blood vessels. This enhances blood circulation in the body and prevents fluid pooling at the lower extremities of the body. In fact, studies have shown that magnesium supplementation can reduce swelling in individuals with edema by up to 20%. Another study in the Journal of Women's Health showed that magnesium supplementation reduced premenstrual swelling by 33% in women. The recommended dose of magnesium is typically 200 to 400 milligrams per day. Number 3. Soak your ankles and feet in Epsom salt. Epsom salt is mainly magnesium sulfate. By soaking your feet in it, you can say goodbye to your lower limb swelling once and for all. All you need to do is dissolve 1 to 2 cups of Epsom salt in a warm bath and soak your feet for 15 to 20 minutes. You may need to repeat this process 2 to 3 times a week. But what makes Epsom salt effective? Well, Epsom salt is able to draw out excess fluids from the tissues through the skin, which reduces swelling. Not to mention, the magnesium in Epsom salt helps relax muscles and reduce inflammation, which can contribute to swelling. Research published in the Journal of Foot and Ankle Research found that Epsom salt soaks reduced foot and ankle swelling by 30% in patients with chronic edema. Number 4. Compression socks. Compression socks apply gentle pressure on the legs, so it helps to reduce the diameter of distended veins and promotes blood flow back to the heart. If you suffer from swollen ankles or feet, then wearing compression socks throughout the day is the solution you have been looking for. This is especially significant if you're on your feet for long periods or traveling. A study in the Journal of Vascular Surgery supports this. This study showed that compression stockings reduced leg edema by 40% in patients with chronic venous insufficiency. This is a form of vein disease where the veins in the legs are damaged and can't function properly. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Massage your ankles and feet. By massaging your ankles and feet, you will stimulate the blood flow and lymphatic drainage of these areas. This will help to move excess fluid out of them. Furthermore, massage reduces muscle tension and promotes relaxation, which can also help alleviate swelling. Just use gentle upward strokes to massage the swollen area towards the heart for 10 to 15 minutes. Apply a moisturizing lotion or oil before you start the massage to reduce friction. A study in the Journal of Rehabilitation Research and Development found that massage therapy reduced limb edema by 37% in patients with lymphedema. Lymphedema is swelling due to the buildup of lymphatic fluid between the skin and muscles. Number 6. Hydration. We all know that we should drink enough water per day for plenty of good reasons. But did you know that drinking water can help decrease the persistent swelling of your ankles and feet? That is right. Having 8 to 10 cups of water per day can do just that. This is because proper hydration ensures that the body maintains an appropriate balance of electrolytes and fluid levels. If everything in your body is balanced, then it is less likely to retain fluids. Not to mention, drinking water helps flush out excess sodium and toxins from the body, which can contribute to swelling. According to a study in the Journal of Clinical Endocrinology and Metabolism, adequate hydration improved fluid balance and reduced edema in 70% of participants with mild to moderate swelling. Number 7. Adjust your diet. If you suffer from chronic swelling of your ankles and feet that doesn't seem to go away, you might want to consider making a few changes to your diet. First off, you can start by lowering your sodium intake. The problem with sodium is that it attracts and retains water in tissue, which subsequently leads to swelling. By decreasing the amount of sodium in your diet, you will also decrease the likelihood of water retention. Studies suggest that reducing sodium intake can decrease fluid retention by up to 10%. You want to aim for less than 2,300 milligrams of sodium per day. Secondly, if your goal is to cure swelling, then incorporate more foods rich in antioxidants and anti-inflammatory properties, such as berries, leafy greens, and fatty fish in your diet. These foods will aid in reducing inflammation and fluid buildup. Number 8. Exercise more. Regular physical activity promotes blood circulation, which helps prevent fluid from pooling in the lower extremities. Additionally, exercise engages the muscle pump effect, where muscle contractions help push fluid back towards the heart. This is achieved because your muscles squeeze the veins in your lower extremities as they contract, which pushes your blood upwards. You should engage in any moderate exercise you prefer, such as walking, swimming, or cycling, for at least 30 minutes a day for 5 days a week. A study published in the Journal of Applied Physiology found that moderate exercise reduced lower limb edema by 25% in sedentary individuals. Number 9. Herbal teas. For a long time, herbal teas have been considered a natural remedy for various conditions including swollen ankles and feet. Certain herbal teas, like dandelion and green tea, have natural diuretic properties. This means that they act on the kidneys and help the body expel excess fluid via the urine. In addition to that, herbs like ginger and turmeric have anti-inflammatory effects that can reduce swelling and pain of the feet and ankles. Studies have shown that dandelion tea can increase the volume of urine and reduce fluid retention by up to 30%. You can enjoy these merits by drinking 1 to 2 cups of the herbal tea of your choice daily. Number 10. Cold therapy. As its name indicates, cold therapy involves cooling the swollen area. You just need to apply a cold pack or ice wrapped in a cloth to the swollen area for 15 to 20 minutes. This should be repeated 2 to 3 times a day. But how does this lessen your swelling? Well, applying cold compresses causes blood vessels to constrict and narrow. So less blood will be able to pass through these blood vessels and reach the swollen area. As a result, the swelling will decrease. Also, if you suffer from pain associated with your ankles and feet swelling, then cold therapy will be ideal for you. This is because cold therapy will reduce inflammation and numb the area, providing pain relief. Research in the Journal of Sports Rehabilitation found that cold therapy reduced swelling by 32% in athletes with acute injuries. So, these were the top 10 home remedies for swollen ankles and feet. Now, we want to hear from you. Have you given any of these remedies a try yet? If you did, how effective was it at curing the swelling of your legs and feet? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.